So let's talk a little bit about our administrative burdens. We can talk about policies and procedures for one. When I was hospitalized last year, at midnight, the team of very kind nurses and med techs came into my room, flipped all lights on, and started singing very loudly to get my unnecessarily needed labs. After I freaked out about that, they tried to draw my blood, not from the 2 existing catheters that were in my antecubital fossa, but actually from my hand, because that was their policy. So I could write a big complaint about why this shouldn't be policy and why this policy and procedure was not created considering the patient experience. And they may try to go and change that, except to change policy, you have to go in front of about 8 different committees, and that's actually just the start of proposing some type of change. So it's easier to not change policy and just keep doing what you're doing and take care of the next patient. Let's talk about how for-profit medicine is actually completely deprioritizing all of our resources and important aspects of humanistic care. Okay, when we walk around the hospital, let's look and see how many patients have amputations and how many patients have limb salvaging surgery, and try to see the social inequity in those decisions. And we know that this is coming from a insurance and coverage system that is not prioritizing environmental changes and administration of appropriate resources. Primary care is really not very well prioritized specialty. Here we need care coordinators, we need nutritionists, we need resources so that primary care physicians can give patients the attention they deserve, but yet they're remunerated very little, and those resources don't exist for them to give back to their community, thus widening these social inequities that the for-profit care system delivers. Let's also talk about AI. How many people are now using AI to help them script communication to their patients? Let's talk about the EHR. We had a patient in pediatrics who had a very serious acute kidney injury, but to try to make a fix in the electronic health record, it was, again, just an administrative burden beyond belief, and it actually still hasn't existed. And the burden is on the providers to collect data and then present to various groups to try to get these safety fixes. CVS just cut 5,000 employees because they weren't making enough money. So now all of the pharmacists that remain at CVS have more supervision responsibility over the pharmacy techs, which I